We have all heard of the Ebola virus, the infection that has caused a huge scare around the world. This current outbreak that we are dealing with right now is the most deadly we've dealt with in history, and it's spreading fast through country borders. Good afternoon, my name is Kayla Robinson, and today I'm going to inform you of the Ebola hemorrhagic virus. During my speech, I will tell you about the natural hosts that cause natives to gain immunity, what Ebola does to our body once infected, and the treatments that are available. According to New York Times, September 6, 2014, virologists did report that part of West African population is immune to the Ebola virus. But how? So I looked on the Center of Disease Control and Prevention website, and it states that people that have had the virus and recovered have immunity, though it's unclear whether they're immune to all species of Ebola and how long they're immune for. Well, but is this the only way that people can become immune? No, it's not. Robert F. Jr., a Tulane expert in hemorrhagic fevers, reports that there have been small case studies conducted in West African households that prove family members that have taken care of Ebola victims have indeed been infected with the virus but never fell ill. This would mean that they have some kind of immunity, right? So they have some kind of antibody built up within them to prevent this virus from tearing apart their bodies. So what is it? The New York Times, September 6, 2014, backs up the claim that natives have gained immunity through a couple of ways. One, by eating undercooked bat or primate meat that may have the virus within it, or eating contaminated fruit that have bat saliva or other bodily fluids on it. Either way, these natives are exposed to very low doses of the virus. And since the doses are so small, it means that they have more time to fight off the virus because the virus will move slower than the normal rate. Now that I've talked about people who are immune to Ebola, what about people like you and me? What about people that aren't immune? What does it do to our body? Explainer March 17, 2015 states that Ebola kills 25 to 90% of infected victims. I don't know about you, but I don't want to gamble those odds. There are 5 species of Ebola that somebody can catch. ZAR being the most deadly of the 5 and the one we're currently dealing with in West Africa at this time. So what does it do once we get infected? Well, The Guardian, October 22nd, 2014 states that Ebola is an acute viral illness that works systematically. The disease begins by releasing proteins that attack the immune system's first line of defense, which are dendritic cells. Now, our dendritic cells are responsible for releasing T cells, or white blood cells, that fight off any infected cells before they can replicate. But since these dendritic cells are consumed by the virus then spreads into your collagen, and it settles there, eating away at it over a quick period of time. Now, oftentimes you'll see pictures on the internet of patients that'll get white blisters and red spots along their skin and tears just because the Ebola virus is tearing them apart from inside out. You've also seen spontaneous bleeding, eyes, nose, ears, mouth. It's pretty traumatizing. But at the same time that this is all happening, the macrophage cells create blood clots within your blood vessels. And when pressure builds up, your blood vessels will explode, which means it will cut off the blood supply to your vital organs, and they begin to shut down. Now, oftentimes, when these patients die, it's due to multiple organ failure, overreaction to the immune system, and substantial blood loss. So how do we treat these Ebola patients? The Center of Disease Control and Prevention website states that patients are treated with early supportive care. This will ensure a higher rate of survival. This includes maintaining adequate cardiovascular function while the immune system mobilizes an adaptive response to fight off the illness. Now, nurses are often told to give the patient fluids and electrolytes to replenish after symptoms of diarrhea and vomiting. It often dehydrates the body, as well as respiratory support due to low oxygen status. Now, without these, the patient has little to no chance of surviving because you have to be healthy enough to even fight off a virus, right? Now, there are not any proven treatments that neutralize the infection, but there are some drug therapies that are available as well as blood transfusions. The New York Times, September 6, 2014 states that an experimental drug being the most popular at the moment is called ZMapp. Now, ZMapp is made up of 3 monoclonal antibodies produced within tobacco cells. This drug is meant to help assist during the recovery process. It doesn't cure you. In fact, the New York Times, September 6, 2014 states that Dr. Kent Brantley, one of 2 American doctors that were first infected with this illness, received this experimental drug. Though the drug is in phase 2 trial, and we cannot prove that it was effective during his recovery, but hopefully mid-year we'll have those answers. Today I've informed you about the natural hosts that cause natives to develop immunity, what Ebola does to the human body once infected, and the treatments that are available. I can honestly say Ebola is the last thing I want to experience, and I'm hoping we can find a cure and a way to prevent Ebola from ever having an outbreak again.